information given by EPCOR, Mr. Rector of EPCOR. This is the second portion of the first.
Once again, that'll be based on the data that we've got and the guidance.
If I could just step in for a moment, what I propose is to keep
on the 25th of August,
down the line and everyone can have
you will find
statement, and then we'll do
the fire department, the mayor,
afterward, okay?
Fraser-Health, Mr. EPCOR,
Good afternoon,
Mr. Rector.
everyone. I'm Brodkin from Fraser-Health. And the role of the health authority when it comes to drinking water is to administer and enforce the Drinking Water Protection Act, which ensures that everyone in BC has safe drinking water. On a day-to-day basis, what that means for a city like White Rock is that we work closely with the operator to ensure that they are meeting the requirements of the Act, that they are doing everything they need to do to deliver safe water to their customers, and that they have an emergency response plan in place. And our relationship with EPCOR has always been good. We've enjoyed a very happy working relationship with them, and we've been satisfied that they are doing what they need to do under the Act. When there is a crisis like this, it's the responsibility of the health authority to issue a boil water notification, and we did that in conjunction with EPCOR on Friday evening, and then to work with them every step of the way to ensure that they're doing what they need to do to find the source of contamination, to remediate and clean up that contamination, to put a process in place to try to prevent that from happening again, and that they have tested and retested until we are absolutely certain that the drinking water is safe for the customers. The other thing that we do in a situation like this is to watch the community very closely to make sure that there's no illness that could be associated with contamination. And we do that in a number of ways. We are working closely with Peace Arch Hospital and watching the patients that are coming into the emergency room to make sure that there are no clients that have symptoms suggestive of a waterborne illness. We're monitoring the data that's coming from physicians who see clients in their office, that goes to the Ministry of Health to make sure that there's no drastic increase in gastrointestinal billings. And we're also watching the labs, because the pathogens that cause illness from a waterborne source are reportable, and so we would see those coming through the labs if again, there was an increase in the waterborne cases. And again, I'm very happy to say that so far, all of the indicators have been good. There are no signs that there has been any increase in illness as a result of the contamination. But we check that daily, and in fact, several times a day.
Okay, well, we'll move the microphone here. I'll just step in, but take that.
Give us one
so
here.
So next to speak will be Lemire from White Rock Fire.
Big fuzzy.
This is Mr. Phil Lemire, Fire Chief, White Rock.
One hand held. I got it. There we go. My apologies.
Good afternoon. My name is Phil Lemire. I'm the emergency coordinator for the city of White Rock, and I just want to provide some reassurance to our residents that the city continues to work closely with EPCOR in a support role, assisting where we can. We have regular meetings throughout the day, and we're well aware of their operational plans. The city staff continue to provide direction to the public with providing updates as they become available, and as well trying to fast track some city processes to ensure that EPCOR's work can continue to proceed as quickly as possible. That's what all I have to say right now.
So I'll move the recording devices and we'll hand it off to the mayor. Is this okay here? Or you prefer it over there?
Perfect, yeah.
Hang on, bear with the folks.
Don't forget to visit the website www.tourismwhiterock.com.
Thank you.
tourismwhiterock.com.
City of White Rock. I just wanted to assure the residents that safety and health is the highest priority of the city and of the council, and that we are doing all that we can do in a support role to help EPCOR and Fraser-Health to resolve this issue as quickly as possible. Our focus right now is on resolving the issue and restoring our water back to a safe standard. Our staff is working tirelessly to support Fraser-Health and EPCOR in their efforts to restore the water. So I again want to reassure the residents that everything is being done that we can do, and are hopeful and that this will be resolved quickly. And again, thank the residents for their patience and understanding in this very difficult situation. And I appreciate all that the people of this community have been doing to support each other and coming together in this situation. Thank you.
Okay, I'll hand it off to Joan, and she'll facilitate some questions and answers.
Okay, if you just want to catch my eye, I'll keep it rolling. Julia?
Just have to move the microphone, but I wondered if I could see Dr. ask a question for you. Certainly good news, we haven't seen a spike at the ER with people coming in with gastro. Can you give me a sense of how common it would be that we would see results right away? I know that some information available through health sites says that E-coli can actually take up to 7 days before it presents.
That's true, although it's important to remember that the E-coli that has been found in the water is not, the importance of that is not just the E-coli itself. E-coli is a marker for fecal contamination. So most E-coli are actually not pathogenic, which means they don't cause disease. But the reason we look for E-coli in drinking water is because it's a bacteria that's only found in the guts of warm-blooded animals. So if you find it in drinking water, you know that that water has been contaminated by fecal material. And fecal material doesn't just contain E. coli, it contains a host of pathogens that can cause people to become ill. So it's important not to get fixated on the E. coli itself, but to recognize that we're assuming that the drinking water has been contaminated, and it can be contaminated by anything that makes people sick. So to answer your question, the symptoms that people might get if they were to become sick because of exposure to this drinking water could be anything from abdominal discomfort to nausea to vomiting to diarrhea to bloody diarrhea. It would depend on the pathogen that had infected them. And we are watching for all of those kinds of symptoms, and we're watching at a variety of different places. The first place people will go would probably be their family doctors, so we're watching what the family doctors are doing. And you're right, it can take a few days for those results to come through the lab, so we're watching the lab as well, but that's not the only place that we're keeping tabs on things.
Yeah, I do one quick follow-up question. Just because White Rock has a very high percentage of seniors who I think are kind of a fragile population, does this pose challenges in trying to help seniors keep an eye on, for others to keep their eye on seniors and how they're feeling?
We are always concerned about the more vulnerable people in the population, but again, some boil water notifications are only about seniors and others who are particularly vulnerable. This one is about everybody. We have to assume that the pathogens that could be in the water could make anybody sick, so we're keeping an eye on everyone, including our seniors and other vulnerable.